Rhinoplasty, or plastic surgery to the nose, is not just done for appearances. Many times it can be functional as well.
Dr. David Holcomb from Holcomb Crathen Plastic Surgery and Med Spa joins us now with more on that. Dr. Holcomb, good to have you back.
Thank you.
So, oftentimes when people are getting a rhinoplasty or a nose job, are they getting it for cosmetic purposes or to help them breathe better, or both?
In many cases, it's both. Certainly, sometimes it's purely cosmetic, but other times there are some functional airway issues. So the septum may be pushed a little to one side, the turbinates may be a little bit large, or there may be some sort of collapse in this area where people have a trouble sort of sleeping unless they use a breathe right strip, for example.
So you can go in there and take care of not having to use that strip anymore?
So we can put cartilage grafts in selectively in certain locations to sort of serve as an internal breathe right strip.
Great.
So it would be really nice to see some befores of, and afters of your work, because you do such great work. And in looking at this one in particular, tell us about this young woman.
So she'd had a prior rhinoplasty and just was unhappy with the outcome in terms of the shape of the tip of her nose. Just didn't have a lot of definition. On the front, you see sort of a wide, sort of, we call it bulbous tip, and then from the side view,
there she is.
you just don't see sort of a lot of definition there. It's just very rounded.
So this had been basically a job that was done prior by another plastic surgeon.
Sure.
Do you get a lot of that kind of work, a lot of revisions, and does it make it more challenging?
Yes, so I do quite a few revisions, and certainly I think most plastic surgeons would acknowledge that revisions are more difficult. You know, you have to figure out what was done before in terms of maybe too much sculpting was done in one place or not enough was done in a different location, and you have to sort of offset, make up for that. And there's always scar tissue from the prior surgery, so it is more challenging.
The before and afters are really beautiful and subtle. It's not like you're changing somebody's look 100%. You're just making them look better.
That's true in some cases where, you know, I might feel and the patient might feel that there was really a fairly significant change. When they go and interact with their friends and family who obviously know them well, if they maybe have changed their hairstyle or hair color or clothing, they may not really pick up on, you know, what happened.
No, it's very good work. Would you consider the nose job to be the more challenging or the most challenging, difficult surgery that you do and that other plastic surgeons do?
I would say it certainly ranks right up there because you're working on both bone, cartilage, and then skin, and having to do things internally to sort of stabilize, you know, the ultimate shape that you want. It can be challenging.
What is the downtime these days for people who get a rhinoplasty?
So 1 week for initial healing. At that point, the sutures are removed and the external splint is removed. And at that point, people are certainly back at work and back out in life, but we really should take at least another week before resuming vigorous aerobic activity.
Okay.
When should someone, you know, if you talk about age, a lot of young women are getting plastic surgery done younger and younger. What is an appropriate age for someone to come in and discuss a nose job, potential nose job with you?
Sure. So we see patients as young as 14 and patients who are even a bit older, even into the 60s and sometimes even later than that, who may have always wanted to do something about the shape of their nose but finally got around to it. But 14, at that point, the face and nose are pretty much fully developed, so we feel comfortable at that point, you know, intervening. And
it can totally change somebody's life because it can really impact their confidence.
Absolutely.
So you can schedule your consultation at Holcomb Crathen Plastic Surgery today by going to sarasota-med.com or tampa-med.com.
And thanks again, doctor. We'll be right back.
Thank you.
Thank you.